Hey guys, Jeff Lewis from Lewis Physical Therapy and Sports Rehab here. I want to talk to you guys today about something that I see all too often in the clinic, and that is youth throwers dealing with elbow and shoulder pain. So, for the sake of this conversation, when we say youth thrower, we'll say anywhere from 10 to 14, or we'll say 10 to 15 years old, and we'll talk a little bit why. We'll talk about a little bit why we use that age range here in a minute. But specifically to this group, almost all the injuries that I see in this population are overuse injuries in the elbow or the shoulder. So one of the most common things that is going on in the elbow for youth throwers is Little League elbow. You may have heard of it, you may not have, but Little League elbow is really an inflammatory process at the growth plate in the medial elbow, specifically on the medial epicondyle. The reason being is because the continuous throwing motion is going to place repetitive valgus stresses on the elbow here, and that growth plate does not close until they're about 16 years old. That's why we really stopped and capped at about 15 years old. So again, because that growth plate isn't closed, when they have continuous throwing, and when we say overuse, this is typically a pitcher or baseball player that it is the only sport that they're playing. They're playing consistently for more than 8 months out of the year, and they have sacrificed playing other sports in order to play their one sport, in this case being baseball. And as part of that conversation in terms of throwing more than 8 months out of the year, some people might say, well, I only play on a team 8 months out of the year, but I still train the other 4 months out of the year. I still count that. If you're throwing routine bullpens during the off season, even though you're not in games, you're still getting a lot of high intensity stress on that elbow with bullpen. So when we say, it has to be no more than 8 months, like that's like those 4 months of not throwing in general. That's maybe playing another sport, but just not picking up or throwing a baseball in those age ranges. So in this population, one of the biggest reasons these overuse injuries happens is guys pitching through pain or fatigue. So starting with fatigue, what does that really mean? Fatigue is really just a matter of someone's going through their outing and their arm just gets tired, and they know it's getting tired, and they keep pitching through it. That's most common issue in these weekend tournaments where guys will, out of a 2 or 3 day span, they're playing in 5 or 6 different games. And okay, maybe they only pitch in one game, but if they're pitching in one game, they might be catching in a game later that day or a game the next day, and you're still getting a ton of volume on that arm. So these tournaments are not strictly to blame, but it's a perfect example of the overuse side of these injuries. So pitching through fatigue, that alone is going to be one of those things where the more that you pitch while you're tired, the more likely your mechanics are going to change, and as a result, you're putting more stress on your arm. And the other biggest factor in this age range that I see is guys pitching through pain. And it is tough at those younger ages in terms of, what's pain versus what's sore. It's natural for guys to be sore after their outing. The problem becomes when that soreness lasts for more than a day or two, and especially if that soreness starts to become sharp, pinpoint pain in one area versus the other. You see some swelling, they're starting to lose range of motion. Those are more the red flags that we typically will see in terms of guys pitching through quote unquote pain at that point. So again, once you have a guy starting to pitch through pain, especially when they're fatigued, their risk of injury, I think it's upwards of like the risk of injury for a shoulder or arm injury jumps up about 36 times. So again, the biggest thing that I try to stress to parents and athletes at that age is when you get tired, especially when you start to feel pain, do not keep pitching. A lot of this stuff can be not avoided, but maybe not result in as significant of an injury, you being shut down or them being shut down from throwing as much. Just speak, you make sure you're just having an open line of communication. And when something doesn't feel right, contact a healthcare professional, reach out to your local PT, orthopedist. Really, I would honestly almost say start at PT, so that way you can, start with a PT that knows baseball and the demands of baseball athletes, especially pitchers. And then at the same time, get started with, if they feel it's necessary, if you need to see an orthopedist, at least you're getting started from a rehab standpoint, so you're not losing a couple weeks of your time getting back to throwing. So again, to bring it all together, in the youth athletes, ages from 10 to 15 years old, one of the biggest things that I stress that I feel could not prevent, but decrease the severity and intensity of a lot of the overuse injuries I see in this age range. Again, that's Little League elbow. You're not really going to see as much UCL at those age ranges because because the growth plate is weaker than the UCL. So UCL is not normally a problem. Not that it can't be. It's just not as common. Little League shoulder, rotator cuff issues. Some guys have essentially Little League elbow to the point where they pull that bone right off. They pull the bone right off that growth plate. And again, that's surgery at that point for most often than not. Certainly stress fractures. So again, biggest takeaway message here is don't pitch through pain. If you're fatigued, make sure you're communicating with your coaches. Make sure you're monitoring your workload, making any changes, working with them as needed. But again, if you are either a parent of a youth athlete or you're a youth athlete yourself, you found this content information helpful, go ahead and like and subscribe to our channel. Leave a comment below of any questions you have specific to baseball players, pitchers, performance, or rehab, or check out some of our free resources we have down below dedicated specifically to baseball players.